it's Hannah. I'm going to be showing you how to don your sterile gloves. These will be used for any sterile techniques like inserting catheters and all that fun stuff. I just wanted to show you a closed package first. So they're going to say some type of surgical gloving, and somewhere on here it's going to say sterile. And they have different sizes, okay? And the size should also be on the back too. So you'll just open it up just like a Band-Aid and slide this part out, okay? And before all this, you've done your hand hygiene and making sure your hands are dry. Next, we're going to unfold this package. Try not to touch anything in the middle because it's sterile. So we unfold. I like to kind of make sure it stays pressed open, grabbing just barely on the sides. Then you're going to fold these creases up and back a little bit so it's mostly flat. The last thing we have to open, you slide under, just barely touching this edge, and again kind of pulling it not super hard so your gloves go flying, but enough that it's kind of firm and stretched out. So you have your two gloves. You start with your non-dominant hand you make an L shape, so your pointer and thumb. You lift just barely on the cuff of the glove for your dominant hand. You're going to insert your fingers, again only touching the cuff, and slide it on. If your fingers don't find the right finger holes at this point, just leave it. We'll be able to fix it later, okay? Now the trick is leaving your thumb out. So hitchhiker thumb, two fingers. Now we're going to go sterile to sterile. So we're going to slide our sterile fingers between kind of where the palm of your hand would go. You slide your other hand into the glove, and then you can pull down your wrist. Now, oftentimes some of my fingers don't quite reach the holes. Now, because you're both hands are sterile, you can readjust and fix it. Just do not touch the insides of your cups because those are no longer sterile, okay? So it's only sterile and sterile. And then pick up your trash, don't drop your hands below your waist, and dispose of any of your trash. And that's it.
ATI accepted practice and indications for surgical gloving are to maintain sterile field and that both hands must not touch the outside surface of sterile gloves. ATI evidence-based practice is to perform hand hygiene prior to gloving. Some key considerations are to not contaminate gloves, keep hands above the waist, no artificial nail use. Some documentation tips are to document the procedure performed and the patient's response.